Hello, welcome to Dr. Soma's Corner. Today we are going to discuss a very important topic. Before you continue your story or your testimony on how you went to 50 hospitals and 49 and a half rejected you, it is important to discuss exactly what might have transpired. It's okay to say that you went to an hospital and you were referred rather than being rejected. Most hospitals will not reject you, but rather they will refer you based on certain points, based on certain reasons. Referral is different from rejection, all right? Why hospitals are obligated to treat patients, especially emergency patients in emergency cases, at least it's not for another thing, but for the patient to attain stability, to stabilize that patient. There are conditions where hospitals may have to refer a patient out and not necessarily termed rejection. For instance, when the condition of the patient is higher than the capacity for the hospital to manage, hospital can refer a patient in that regard. For a patient requiring specialized care that the hospital cannot provide, for instance, for cancer patients who may require the services of an oncologist, or patients with cardiovascular problems who may require the services of cardiologists, an hospital can refer such patient out. For a patient who need access to specific treatment or therapy, for instance, radiotherapy, for an hospital who do not offer or cannot offer such services, that patient can be referred out. A patient who requires specific investigations that an hospital lacks the equipment or the expertise to carry out can also be referred out. In an hospital that is not equipped to manage specific disease condition, they are not encouraged to take in such patients. If you can't offer the services required, it is best you refer that patient out to a better place. An hospital can refer a violent patient or an aggressive patient, especially if they pose a safety risk to others or even to themselves. If the patient's behavior cannot be managed within the hospital, an hospital can refer such patient out. And or even patients who are overtly aggressive, threatening, potentially endangering the life of staffs, such patients can be referred out. For patients with psychosis or psychiatric or mental health issues, such patients can be referred to specialized care centers where psychiatrists can attend to such patients. And when the hospital's capacity is full, so that they can no longer admit or they cannot admit more patients, such an hospital can refer you. On a more serious note, it is very vital that we tell ourselves the truth always. Most hospitals will not reject you, rather, they may refer you. And it is because we are already centered on the fact that why are they not accepting us that we often will not take the referral note that they will write to us. All right. So we end up going to sugarcoat our testimonies and trying to make it look bigger than others. It is not. Sugarcoating it or bringing hospitals down does not make your miracle bigger. Whether you survive by medical intervention or by miraculous intervention, the fact that you survive the illness is a miracle on its own. So you don't have to paint others black to dignify your testimony. So let's keep it in mind that most hospitals will refer you to a better center and not reject you. Let's use the appropriate terminology, even in testimony. It does not reduce the essentials or the vitality in the testimony. Thank you.